everyone, today we're talking about the stomach and the stress that the stomach can have and what you can do just by hands-on to alleviate that stress. The stomach is really amazing. It can hold up to a quart of food at a time, and it helps you absorb B12. It is part of your immune defense, so we need it to be functioning properly. Emotionally, it is a social and professional image of ourselves, so we can put a lot of stress on ourselves to look a certain way to the population, and the stomach carries that kind of stress. Here's your mouth. Your esophagus will come down along your sternum, and somewhere about here go into the stomach. Now, a sphincter simply is a fancy valve that regulates open and close. So when we talk about sphincters in session, the open is clockwise, close is counterclockwise. So that's a simple view. When a sphincter is not working properly, it will sometimes be stuck here or just open and close a little bit. It could be more closed than open. Close, open, and we want it to be more open, close, like this. So those are things that I'm feeling. This is your collarbone up here. We'll say your ribs slope down nicely and come back up. Now we're going to draw some ribs in here. Okay, you have this nice, most people have a nice protruding little bone called your xiphoid process. This is your sternum. Okay, so you can a lot of times feel this as a bony landmark. Small percentage of people do not have a xiphoid process, but it will be tender in this area if you press lightly. So the stomach, as you can see, part of it will be up under the ribs. A good portion of it can be down here. Now, when your stomach is full, it can be all the way down in your, let's see, this is your belly button and the tops of your hips. So the stomach can be sitting down around here. The bottom of it can be sitting even down towards your hips. Now, different things can influence this. It can be your stomach is full. It can be you're stressed. It can be you've had surgery in an area and there's some scar tissue grabbing onto it to pull it different ways. So what we want to remember with your anatomy is anatomy in the real world rarely looks like the book. That's just one picture to give you an idea, but since we are all different and all different shapes and sizes, and we've had different accidents, we've had different experiences, different surgeries, our anatomy may be shifted just slightly over here, over there. Just be looking for those things as you feel for your stomach, okay? Now, ideally, this technique is done directly on the skin. Now, when we're working in the stomach, we want to make sure to keep light pressure with the palms and the finger pads, not poking directly in. So when we grab down in that visceral muscle and the fascia, we want to make sure to kind of pull as such and not with the fingernails. Now what we'll do is go find that middle place just in between the ribs, and we'll follow it off center a few inches to your left side. You want to put the palm of your hand right in that area, grabbing with the pad of your thumb. It'll be about the weight of your hand and a little bit more. Sink in slowly. And we'll use the other hand to stabilize. Now again, not too heavy of pressure, but just enough to engage the stomach. Remember, it's a hollow organ. It'll feel a little bit like a water balloon. Then we can start to press down. That is the direction of the digestion when it comes into the esophagus, into the stomach. And once we reach just below the belly button, we'll switch to the finger pads and press it, just gently pulling back up into that pyloric sphincter area where it can drain out into the rest of the small intestines. This is just very calming for the stomach. This influences the digestion and gets that going. And if you hear gurgling, that's a great sign. If you feel gurgling, that's a great sign. Make sure to take some deep breaths. We'll switch to the finger pads. Gently pull back up. Now you can keep pressure on and just keep circling back around. And you can do this between 5 and 10 times. It should feel good. It should be calming and comfortable. Hey guys, thanks for watching, and send me any questions that you have on this material or if there's anything I missed. We'll see you soon.